All right, today on pharmacology, we're going to be covering oral glucose. All right, this comes supplied in these toothpaste-like little tubes. This is a very viscous, sugary gel. You can see here by the pictures, there's all different flavors to make them taste a little better. They come in lemon and cherry and grape and all this sort of thing. So the class for oral glucose, it is a carbohydrate. Your indications for this would be altered mental status, usually a history of diabetes, and they have to have the ability to control their airway and the ability to swallow. As far as a history of diabetes goes, that's not necessarily true. If you had a patient who had a low blood sugar but did not have a history of diabetes, it would still be appropriate to give this. Things that would cause someone's blood sugar to drop that was not a diabetic. If someone were to go out and start doing some vigorous activity, which is they're not normally used to it, excessive exercise when they're not really used to it, all that muscle use is needing sugar to provide the energy, so they can burn that sugar up rather quickly. So even if they do not have a history of diabetes, it would still be appropriate to give this as if they were symptomatic and had a low blood sugar. Contraindications, when should we not give this? If the patient is unresponsive or does not have the ability to follow commands and swallow and be able to control their own airway, you could not put this in their mouth. The dose and route. Your typical dose, there is no one standard dose for oral glucose. We're going to titrate this to their mental status, so we're going to just keep giving them a little bit at a time until their mental status improves. This is usually somewhere around approximately 1 tube is usually what you're going to get through before the mental status is well enough to where they can follow commands, they can swallow, and then it would be more appropriate to switch from this to some type of food, things like eggs, peanut butter and jelly, something a little more complex. This is a simple sugar, so we're going to get a rapid spike in blood sugar, but it's because it's a simple sugar, it's also going to wear off fairly quickly. So we want to just get their mental status up enough for them to follow commands, and then get some food in them and transport them. Even though you got these people back to a mental status that was somewhat normal, we would still want to transport these people to the hospital to find out why their blood sugar dropped in the first place. The route of administration, this is buccal, or some people pronounce it buccal. Either one's fine. It simply means between the cheek and gum. You can use you can simply just stick the tube, pull their cheek back and stick it between their cheek and gum and squeeze just a little bit in there at a time. Or some places may want you to use like a tongue depressor. Put it on the tongue depressor and then wipe it in between their cheek and gum, rub it around a little bit. This is designed to be absorbed in the mucosal membranes of the mouth. If they were to swallow it, that would be fine. But it's mainly meant for absorption through the mucous membranes. Some of the precautions with this, if they are kind of in between with their mental status, you really need to make sure these people do not aspirate on this. If you guys got any questions, as always, hit me up. If not, you superheroes get out there and save some lives.